Travel nurses have been instrumental in filling the staffing needs during the COVID-19 pandemic. While most hospitals admit they could not have made it without them, it has been a mixed blessing. Animosity has grown between the core nursing staff and traveling nurses who are contracted to do the same work for much higher pay. Thousands of nurses quit their jobs to work for travel agencies, accumulating funds to pay off student loans, make house down payments, etc. Most hospital leaders with staffing shortages understand this and welcome them back at the end of their traveler's contract. Contention between core staff and contract labor is a growing problem, especially as travel nurse rates continue at record levels. Core staff say they regard travelers sometimes as outsiders, and many travelers say they don't always feel accepted by the team. Half of the travel nurses surveyed said they received poor treatment by the core staff and were being assigned the heaviest caseloads. Disharmony increases when travel nurses are not mandated to work beyond the hours designated in their contracts, while core staff have mandatory overtime. Both the regular staff and the traveling nurses are suffering from burnout, further stressing the shortages and spurring some to consider leaving their jobs altogether. A report from McKinsey found that 32% of registered nurses surveyed in the United States last November said they may leave their current direct patient care role, an increase of 10% in less than 10 months. The average bedside RN turnover in 2020 rose to an all-time high of 18.6%. This jump is up nearly 2% from before the pandemic and represents the largest annual increase in 7 years. With the highest COVID-19 peaks getting behind us, healthcare leaders and frontline nurses now have a bit of breathing room to reevaluate their employment and maybe seek new jobs. Combined with a tighter labor market, skyrocketing sign-on bonuses, and fierce recruitment tactics, nurses are feeling disengaged or ambivalent in their current roles and now have powerful motivation to leave. Hospitals are struggling to find enough staff as stress and burnout run rampant. In response, systems have ramped up hiring efforts, boosted their benefit packages, and offering huge sign-on bonuses. But that's not the only answer. Employers are looking to recruit and retain nurses, both in short-term and long-term, and they need to move beyond sign-on bonuses and create cultures where nurses feel engaged and where they want to stay. Self-Care for Healthcare clients had a 20% increase in engagement. How can we help you recruit and retain your nurses?